All right, Molly Schaff going to be going over the physical assessment of the thorax and lungs. I am finally home. I have not unpacked, let alone gone through my uniforms to set them up, so I will just be wearing regular civilian clothes this time. But with next physical assessment, I plan on wearing my uniform just to get in that good practice. This will be my permanent party patient, my husband Matthew. So different patient, different potential, health concerns for the physical assessment, but of course, as always, it's good for practice. So we'll go ahead and we'll get this physical assessment started. So, hello, Mr. Schaff. How are you doing today?
I'm well. How about yourself?
Doing good, thanks. I'm going to close the curtain for privacy. My name is Molly Schaff, nursing student. I'm going to go ahead and add some Germax, sanitation. Can I please see wristband, and can you go ahead and tell me your full name and date of birth?
Matthew Schaff, February 14th, 1994.
Great. And do you know where you are right now?
Yes, I'm at our house in Macon.
Okay, great. So patient is already responding correctly, appropriately, not showing any concerns of immediate distress. So we can go ahead and I can ask more questions and go through the assessment without any concern of him incorrectly answering any questions. All right, Mr. Schaff, so today we're going to be going over an assessment of your thorax and lungs. Before we do that, I do want to go over a couple health history questions just to get some more information for you before we proceed. Are you okay with that?
Yes, of course.
Okay, great. Couple questions. First being, are you experiencing any lung problems, or do you have any concerns with your lungs?
No.
Or do you have any problems breathing?
No.
Are you feeling any tightness in your chest?
No.
Do you feel any pain in your chest, or almost like a sound of heavy wheezing or noise breathing or coughing? Are you coughing up any sputum or mucus?
No.
Okay. Are you coughing up any blood?
No.
Do you yourself have a history of lung problems, or do you have an immediate family member with any lung problems?
No.
Okay. Do you have any environmental hazards that can potentially affect your breathing that you're exposed to?
Yes, my work as an aircraft mechanic, I'm exposed to aircraft exhausts and also skydraw.
Okay, so with those environmental hazards, have you noticed any concern in your breathing when you were exposed to those hazards?
No.
Okay, you're just exposed to them throughout. Is it often, like every day that you're exposed to them? Is it weekly, monthly? By chance, do you know?
Daily.
Daily. Okay, so with it being daily, there could be more of a concern, maybe not now, but down the road with any kind of respiratory issue. But he said he's currently not experiencing it, so we're okay there. And then lastly, do you smoke?
No.
Okay, great. At this time, I would like to proceed with the physical assessment. I will ask you to drop your gown so that your upper torso is exposed. Are you comfortable and okay with that?
Yes.
Okay, great. And based on the assessment and what we're asking for is, of course, when it comes to the time for palpation, you would palpate the anterior part, but this physical health assessment is only asking for the posterior, so just to make note, I am aware that I would have to do the anterior part. But we're first going to start with inspection. So patient is calm and breathing. I'm going to look at my watch and look at his breaths for a minute. So as I'm just letting a minute go by, I'm going to count the breaths. While I'm counting his breaths, I'm going to be looking for any signs of bone protrusion, which could be a rib, or maybe his sternum is, for whatever reason, just disfigured, damaged or whatsoever. I'm going to look for nostril flaring. I'm going to look for lips being pursed. I'm going to look for accessory muscles being overused. If he's hunched and he's a barrel chest, it can cause more tightness in the neck. It can cause the back to kind of hunch forward. It can cause tightness in the chest. But I don't see, based on the posture, any kind of barrel chest. I don't see pigeon chest or the vacuum one. He seems to have a very normal chest. He has good posture. I'm not seeing any issues with his breathing. It is symmetrical with his inspiration and expiration. He doesn't have a super large rise and fall with his chest, but it is present. A minute has gone by. I counted 16 breaths per minute, which is a healthy count for an adult. From here, I'm also observing his trachea. It's presented down the midline, no concern there. Doesn't seem to be fixated on one side over the other, so I'm assuming there's going to be no obstruction in the airway. We obviously know that with the interview prior as well, so super easy there. His skin color is symmetrical and beige. I'm not seeing any clubbing in his fingernails. And with it being beige, I'm not seeing any signs of pulmonary cyanosis. So because his skin is neutral beige, no concern there, no clubbing. From here, I'm going to assume, based on my inspection, I see no concern with his breathing. But of course, we're going to move on to palpation. So, Mr. Schaff, can you go ahead and turn around for me?
Sure.
Great. All right, Mr. Schaff, I'm going to go ahead and I'm going to place my hands on your back to check your temperature. Are you okay and comfortable with that?
Yes.
Okay. Skin is warm and notably dry, so no concern there. I'm also going to check and just let me know if anything hurts when I'm touching your skin, okay? Okay. Just take normal breaths for me. Did you feel any sensitivity, tenderness, pain?
No.
Okay, and I didn't notice any lumps as well, so once again, not noticing any lumps, so ribs seem to be properly intact. His posture would show me that as well, once again, and with that, intercostal spaces, from what I could feel appropriately separated. Okay, I'm going to go ahead and I'm going to ask you to, I'm going to check for tactile fremination. Go ahead and say 99 for me.
99, 99, 99, 99.
Okay, so no issues there. It was verbally presented through, and there was no low or high frequency when he was saying the 99. Go ahead and take a deep breath for me. Okay. Separation of the lungs is separating with about 5 centimeters, so once again, appropriate. Mr. Schapp, at this time, I'm going to go ahead, we're going to go into percussion, so I'm just going to do some taps. Resonant, 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 little dull resonance, dull resonance, resonant, resonant, little dull resonance, dull resonance. So resonant throughout the whole part of the back, noticing at that lower area, obviously where there's not as much lung surface area, it's going to be more dull, but still resonant nonetheless. So symmetrically left and right side, percussion is fine, not seeing any kind of concerns of any obstruction with the air, no consolidation, no fluid. And at this point, I would also additionally test his diaphragm, which would be through the symmetrical lung excursion assessment, and that's when I would ask my patient to expirate first, and I would palpate down, and then I would make a mark on both left and right side, and then I would ask him to inspirate, and once again, while his lungs are filling, or while they're full, I would go ahead and percuss as well, and I would make those marks. From there, I would use a ruler to measure, and you are really looking for anywhere from 3 to 5 centimeters for a space, and that's appropriate range for the diaphragm. If it's anything that's lower or higher, it could cause a greater concern, just where maybe their breathing isn't as good, or if there's something that's obstructing the diaphragm from expanding or contracting. Mr. Schaff, at this time, I'm going to listen to your lung sounds, if you don't mind turning around for me.
Sure.
And I'm going to ask that you go ahead and take deep breaths, and that you have your mouth open when you do. So big deep breaths, just, okay?
Yes.
Do you understand?
Yes.
Are you okay with that?
Yes.
Okay, great. Vesicular. 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 Okay, so every area, in the areas that I encapsulated, I heard vesicular. I didn't hear bronchiovesicular or bronchial, which is appropriate for the areas that I examined. I also didn't hear any adventitious sounds such as wheezing or stridors, which is good because that would cause a greater concern, and I would definitely annotate that in order to have a further assessment done. So now I'm going to do the auxiliary sides. So, Mr. Schaff, can you go ahead and just move this ever so slightly, not to cause any stress or strain, just relax, just move it back a little bit. So I'm going to be checking the upper, middle, and lower lobes of the right side. Vesicular. 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 So breaths, once again, full, steady breaths, not causing any sign of concern of any stridor or wheezing. So I'm doing the left side with the upper and lower. Deep breath. Okay. Okay. Cool. And do you mind turning around for me?
Sure.
I'm now going to be checking the posterior acostylation. Okay. And once again, deep full breaths for me with your mouth open. Vesicular. 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 Okay, so all vesicular sounds once again there. No adventitious sounds to cause concern with either wheezing or stridors. So from here, we're just going to go over bronchophony, echophony, and the whistle pectoroliloquy. Mr. Schaff, at this time, I'm going to go ahead and ask you once again to say 99 for me.
99. 99. 99. 99.
Okay, thank you. So once again, no issues. There's no signs of consolidation or fluid when I listened. So very appropriate. Mr. Schaff, for ecophony, we're going to go and I'm going to ask him to say E. If I hear an A sound, that's a sign of concern for me because that shows that there is consolidation or there's fluid in the lungs that's causing me to hear something different from what the patient is projecting. So Mr. Schaff, can you go ahead and can you say E for me, and can you please hold it until I say stop?
Yes.
Okay. Okay, and I did hear E the whole way through, not A, which is good. That shows healthy lungs once again. And then lastly, I'm just gonna have you whisper 1, 2, 3 for me.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Once again, no issues there. You could hear the subtle whisper, but nothing that sounded like there was straining, stressing. There was no fluid, there was no gurgling or anything like that. So we're good to go. Mr. Schaff, perfectly healthy 26-year-old male, no respiratory concerns as far as my assessment went. No signs of crackling, wheezing, stridor, or any kind of lung obstructions. Breathing was normal, symmetrical the whole way through. Skin is not discolored. There's no signs of stress. There's no accessory muscles that are overworking. And ultimately, he is a perfectly healthy male that can continue to live his life the best way possible.